A Nova Scotia doctor says the province's surgical backlog is likely to grow. Cardiac surgeon Dr. Greg Hirsch says doctors are diagnosing patients with diseases that have progressed significantly compared to what they saw before the pandemic. Dr. Hirsch says he expects wait times for surgery will be climbing because doctors are encountering more advanced disease. Meanwhile, across the country, many Canadians are struggling to find a family doctor as the pandemic leads to burnout. A new book by Susan Martinuk is taking a look at healthcare systems across Canada. Titled Patients at Risk, Exposing Canada's Healthcare Crisis, the book takes a look at the issues affecting health systems across the country. Well, with us now to discuss her book is Miss Susan Martinuk herself. Ma'am, welcome to Forum Daily.
Thank you very much. It's a pleasure to be here.
Now, it's interesting how the pandemic highlighted issues within the healthcare system in Canada that were really underlying, that were there even before the pandemic was an issue. And you yourself have been quoted saying that Canada's healthcare system is one of the worst and most expensive in the world. So can you unpack this for us and tell us how your book really investigates the issues within Canada's healthcare system?
Sure. Well, it's not too difficult to unpack because the facts exist and the statistics exist, and they've existed for years to show that international studies that have been conducted by a number of groups, and as I say, over decades, have shown that Canada ranks in last place in terms of things such as numbers of beds, numbers of doctors, availability of specialists, availability of emergency departments. These statistics have been shown for years. And for some reason, Canadians still seem to believe that they have the best healthcare in the world. And that's just absolutely a myth. And another factor is that they don't realize that they're paying $7,000 a year in taxes for each person to support this healthcare system. And that's whether or not they use the system or not, which is a factor that many people forget when they talk about what happens if we have to pay for healthcare. Well, Canadians are already paying $7,000 a year for healthcare, whether or not they use it.
And as we mentioned, a lot of Canadians are actually struggling to find a doctor. And this was an issue even back in 2019, according to StatsCan. Almost 5 million of us were finding it difficult to find a family doctor. So what needs to be done to really address this issue?
That's right. It's probably about 15% of Canadians, and it goes up to as high as 25% of Canadians in several provinces cannot find a family doctor. And my book, in fact, carries a number of different stories in it from actual patients who, because they were not able to find a family doctor, they received very late diagnoses with cancer. They missed transplants. They even died because they did not have access to a family doctor. So it's a real problem, and it's one that, again, for some reason, politicians do not seem to address. Unfortunately, Canadian healthcare is tied deeply to politics, and so we are reliant on them to get things moving in the right direction. And by getting things in the right direction, one of the things is Ontario Premier Doug Ford recently announced that there are 450 new positions going to be opened in medical schools across the country. Canadian medical schools, their enrollments have been on the decline since the 1990s. And they've been the lowest of any developed country when you look at enrollments. So what we need to do is get more enrollments at medical schools. Then we also need to have jobs for them when they finish and positions at hospitals that are ready, so that after we invest in Canada, again, we're investing in these doctors over the number of years that they are in school. We are subsidizing it. And yet when they're done, we don't have enough positions that are open for them to take. So they go to another school, so they go to another country. And then we're responsible for bringing more people in by immigration and adding incentivizations to them to come and be doctors for us. So it's really a system that's very backwards.
Definitely something we need to address and investigate further. I wish I could ask you some more questions, ma'am, but we are out of time. Where can our viewers have access to your report?
They can get access to the book at amazon.ca. Just Google either my name or the name of the book, which is Patients at Risk.
All right, perfect, ma'am. Thank you again for joining us today on Forum Daily.
Thanks very much. Take care.
All right, up next, we've got more news from around the world, starting with Sweden's decision to apply for NATO membership. We'll have that story and more coming up next.